It's a real pleasure and honor to be here today. Instead of giving a speech, though, I'd like to just tell some stories that frame, at least for me, how the potential for financial health to improve outcomes for individuals and communities, and even possibly transform financial services. So the first story takes place on Valentine's Day of this year. And on Valentine's Day, I was giving a speech to a number of community groups. And after the speech, there was a Q&A session. And so the host, in order to kind of liven up the Q&A session, said, okay, I'm going to ask some questions using I'm going to ask them by asking you to swipe right or swipe left. And I kind of knew what he was talking about. I've been happily married for 20 years. So I am not familiar with the dating apps, but I knew that there was this thing and you swiped right or swiped left. And I had to clarify, is right accept or reject in any case? So for the first few questions, it had the intended purpose. Like it really livened things up. We were able to just talk a bit more informally about certain issues. And then we got to a question where he said, overdrafts, swipe right or swipe left. And internally, it elicited a reaction where I was fairly upset by that question because the way it was framed, because it felt both unfair and unproductive to set it that way. At the OCC, we've been working on overdrafts for a really long time. And I know there are folks here in this room have been working on it even longer. And if you work in that space and on those issues, it's really complicated. It really depends. Does it help or does it hurt? It depends. It depends on a whole host of factors. And how do you make it better? And that framing felt like not the way to move the conversation forward. And I said that. I said, I don't think that this particular way of saying, is it all good or all bad, is going to make things better for those who need a better situation. We need to take a more nuanced approach. Of course, that begs the question, what is that more nuanced approach? Which leads to my second story. In addition to being acting comptroller, I wear a couple other hats. One of them is I'm a director on the FDIC board. And being on the FDIC board, the FDIC has several advisory committees. And so these committees consist of various folks to provide advice and perspective on a host of issues. One of those committees is called the Committee on Inclusion. Shorthand as COME-IN. And so last fall, I dial in, it's a virtual committee meeting, and I didn't really know what to expect. Log on, get in, and I'm pleasantly surprised. It's a fairly small group. It's less than a dozen people. And you've got the FDIC directors and the members. And the FDIC directors start off by saying, hey, here's what's on my mind, here's what I'm thinking about, here are a couple questions. And then you just kind of go around the table. And each person shares his or her perspective on things. And it was really, really good. I really thoroughly enjoyed it. And about halfway through, there's Jen Tescher. And with Jen, I had heard of her, but I had never met her before. And Jen started off by stating, I'm paraphrasing here, she said it much more eloquently than this, but she said something to the effect of, we're going to have to redefine financial inclusion because the definition right now, everyone uses kind of unbanked, and the number of unbanked in the country is trending towards zero, but the problem of financial inclusion is not trending towards zero. And that just really resonated with me. I'm like, that's a real, there's so many things that kind of are tied up in that framing. And then, of course, she then proceeded to just present a lot of statistics and a lot of studies from around the world, different efforts on financial health, and I'm furiously taking notes. And then after the meeting, I said, I really need to meet with Jen. So I asked my front office to set up a meeting, and then I get a briefing note, and then I'm now going down the financial health rabbit hole, which is a great rabbit hole. I thoroughly enjoyed it because it turns out I'm a latecomer to financial health. This has been going on for quite some time, and I learned about the CFPB has been doing financial health for a bit, so I met with that team. I requested a briefing, say, hey, what are you guys doing in this space? So they shared their methodology, their lessons, their data, et cetera. Queen Maxima from the Netherlands, she was in DC for some World Bank IMF meetings. I met with her. She is the United Nations Secretary General's special rep on financial inclusion for development. Talked through a bunch of issues with her and her team. I started talking about financial health a bit more in public engagements, in meetings with bankers and community groups and academics. Recently talked to a couple academics, Todd Baker, Corey Stone, on their immodest proposal, which is fantastic. And just, my sense is that the underlying concepts for financial health by now are pretty well accepted. And the stars are starting to align with a broader group of folks who are seeing kind of the value in taking a financial health perspective on things. Third story. So I worked at the IMF briefly. I was an attorney at the Fed. I was at the SEC, went through the crisis, the 2008 financial crisis. After the crisis, I had to take a break because I was at Treasury for a little bit. Went to the IMF. And at the IMF, it's a lot of PhD economists. We spent a lot of time thinking about financial stability. And I remember in one of those meetings talking to a PhD economist about the various financial stability efforts that were being undertaken, Dodd-Frank, FSOC, that kind of thing. And at some point, he, being an economist, said, well, what's the objective function? I said, well, the objective function is to eliminate, reduce, minimize the risk of financial instability. And he challenged that and said, well, the best way to do that is just get rid of the financial system. Problem solved. And, it's kind of a joke, but as an economist, that's exactly how you think. Whatever the objective function, you take it to its logical conclusion. And that got me thinking about safety and soundness, consumer protection. There's a lot of things that we focus on where it cannot be the sole objective function, right? Like at the OCC, our mission is safety, soundness, and fairness. Again, we can achieve a safe and sound banking system by not having a banking system, but that doesn't make any sense. There's something else. There's got to be some other objectives there. And I think financial health is a very promising, interesting concept to balance that as perhaps that should be the objective function. Fourth story. So I grew up in Columbus, Ohio. And as a kid, I had asthma. And there were a whole bunch of different reasons for the asthma. Sometimes it was environmental. Grass was a common cause. And in Ohio, where I grew up, mowing lawns is kind of a rite of passage. And I was unable to do that because it would trigger my asthma. And sometimes I'd get sick, I'd get asthma. And my dad was a doctor. And he had this doctor's bag. He had this black doctor's bag that he would carry around with him. And every time I got asthma, he'd bring out this bag. And in the bag, you got stethoscope, blood pressure, all sorts of doctor things. And when I got, depending on how bad it got, take out the stethoscope, check my breathing, check my pulse, take my temperature, take my blood pressure. And depending on those results, we say, okay, you got to take this medicine, or we got to give you a shot. This is before EpiPens, but he was a doctor, so we had things like that. And it wasn't until later I realized, so those four things are the vital signs, right? Breathing, heart rate, respiration, blood pressure. And those vital signs, every doctor, every nurse, every first responder knows how to administer that, to get that information, to make a quick decision about the health of the individual. It's fairly objective, it's fairly quick. And one thing that's interesting is that in the financial health space, the way that financial health information is gathered currently is largely through annual surveys. So just a quick tangent, the Financial Health Network recently put out their most recent survey. It's excellent, and what's great about it is that you get both the high level. This year's report was interesting because I think financial health had ticked down for the first time since that survey had been given. And if you look within it, what's great about the survey is you can look under the hood. What's driving that? Which populations? Why? Fantastic, right? That's a huge advance from where we were before. I think we can do better. I think now, today, we have lots and lots of data on individuals, on communities. I think there's many folks in this room who work for companies who have tons of data. Can we harness that to develop vital signs for individuals? If you could do that for financial health, how are people spending? How are they borrowing? How are they saving? How are they planning for the future? Those elements of financial health by now are fairly well understood, and there's fairly shared agreement conceptually. What if we could measure that objectively in real time for individuals? I think that would transform quite a bit. From a policymaking standpoint, we make a lot of educated guesses about whether a particular product or a particular service or a particular bank is doing a good job in terms of serving its customers. Consider the debates now. You've got debates about overdrafts, buy now, pay later, early wage access, and you get different studies that say either it's good or it's bad. It has a swipe right, swipe left framing to it, and sometimes you need that. I don't want to take that away. There are times where that is exactly what is needed to get to a good outcome. But sometimes you need to be more nuanced. And if you need to be more nuanced, how do you do that? And how do you do that in a way that's credible, that's fair, that results in better outcomes for individuals and communities? And I think with financial health, if we can kind of move in this direction, I'm very curious about moving in this direction. And vital signs, at the OCC, we've been talking about this a bit. We had a talk recently on crypto, where we're trying to get opposing views and trying to tackle that issue through the lens of financial health, not just the usual noise around, is it going to revolutionize the future or not? And I think that that's the kind of conversation, those are the kinds of conversations we want to have more of going forward. I know that the theme for this conference is look back, lean forward. I think it's very interesting. Again, I'm a latecomer to the financial health party movement, and it's very exciting. I think looking back, to go from where things were before, where today there is a pretty broad consensus domestically and internationally what the elements of financial health are. We've got a bunch of surveys that have been done, that have been developed, so we've got some trend lines in aggregate. It's fantastic. I think we can build off of that. I think we are now at a stage where, with data, with partnerships, sharing, collaboration, we can take it to the next level and try to move that down so it's more granular, more real time, more actionable. So with that, I would just encourage everyone that the conferences like this are fantastic for doing that. I really appreciate the opportunity to come speak to you, and I look forward to the other conversations at today's conference. Thank you.